Welcome to the webinar, Understanding Types of Assessment within an RTI Framework. This is one of 11 webinars that we have developed at the National Center on Response to Intervention, and it focuses on types of assessment that are commonly used in an RTI framework. If you have not already done so, it would be a good idea to print the accompanying handouts, as we will pause the webinar periodically, or recommend that you pause the webinar periodically to complete those handouts. My name is Dr. Rebecca Zumeta, and I coordinate technical assistance and product development for the National Center on Response to Intervention. The National Center has developed a series of webinars that cover the information that is important for early implementers of RTI to consider. On this slide, you can see the variety of webinars that are available in the series. And while you can watch the webinars in any sequence, we recommend that you would first start by watching the What is RTI webinar in order to ensure that you have an understanding of how RTI is discussed in the series and the language that we use. Following this webinar, you can learn more about assessments by viewing webinars focused on screening and progress monitoring. Upon completion of today's webinar, participants will be able to not only identify when to use formative and summative and diagnostic assessments, but they'll also understand the differences between norm-referenced and criterion-referenced assessments, and also recognize the different benefits and drawbacks of using general outcome measures and mastery measures for progress monitoring. One helpful way to check your understanding throughout this webinar is to complete the vocabulary handout that we have included in the handouts for this session. The handout provides a table with a list of key terms on the left side and with columns on the right side for you to track your understanding both before and after viewing the webinar. Before viewing the webinar, you should make predictions about what you think different terms mean, and then throughout the webinar, you'll complete the final meaning column based on the definitions provided, along with a picture or sketch or example column where you can add anything that may be helpful for you to remember what you've learned. You can see how in this example I was able to clarify the meaning of the primary prevention level after watching the webinar. If you've not already done so, it may be a good idea for you to pause the webinar to make predictions. Press play whenever you are ready to continue. There are three types of assessment commonly used within an RTI framework. These are summative, diagnostic, and formative assessments. Summative assessments occur after instruction has occurred, and they are an assessment of what has been learned. Diagnostic assessments occur before instruction takes place to help identify different skill strengths and weaknesses. Formative assessments occur during instruction and are intended to help inform instruction. We'll now spend some more time talking about each type of assessment. So the first type of assessment is summative assessment. These measure what students have learned over a period of time. They're typically administered after instruction has occurred and can help you to determine what to teach, but not necessarily how to teach. Summative assessments are typically administered to all students and are often used for accountability decisions and to determine whether students have mastered certain skills. While summative assessments can also be used to allocate resources because they occur after instruction, this decision would be considered reactive because it's occurring in response to how students have performed. If the only assessments you use are summative, you'll need to wait to the end of the school year to make instructional decisions, and that may not always be efficient. So if your goal is to prevent poor learning outcomes and not just identify them by the end of the year, then you may want to consider using additional types of assessment in addition to summative assessments. Some examples of summative assessments include high-stakes tests, including state assessments or state achievement tests, the graduate record exam or ACT or SAT, praxis tests, or other final course exams. And although they provide useful information, they usually require a significant amount of time to be taken away from instruction. They're not always considered valid for individual decision making, so for identifying individual students' strengths and weaknesses, and they don't necessarily tell us why students have achieved different scores. Diagnostic assessments, on the other hand, are measures of students' current knowledge and skills and are typically used before instruction to identify strengths and weaknesses and a suitable instructional program. They're, again, administered before instruction occurs and help teachers to identify whether or not a particular instructional program or intervention program may be effective. Because these diagnostic assessments provide detailed information about individual students' learning, they're often most effective for helping teachers to understand needs of individual students rather than the overall skills of all students. And so they're typically only administered to some students or to students who've been identified as at risk for learning problems. Diagnostic assessments can also help teachers to determine what to teach when selecting appropriate interventions. They provide useful information, but should be used sparingly as they can be very expensive and time-consuming to administer. Some examples of diagnostic assessments may be things like the qualitative reading inventory, a diagnostic reading assessment, key math, running records with error analysis, among many others. The third type of assessment that is commonly seen within an RTI framework is formative assessment. And this is a form of evaluation that is used to plan instruction in a recursive way. They tell us how well students are responding to what we're teaching. With formative assessment, students' progress is systematically assessed during the school year or during instruction to help provide teachers with continuous feedback about learning successes and failures. Formative assessments are typically administered to all students during the benchmarking or screening time of year, and then to some students within the context of progress monitoring. Formative assessments may be formal or informal. Informal assessments are not data-driven, but rather content and performance-driven. Examples may include things like observations or teacher-made assessments. Formal assessments that have data to support the conclusions made from the test, including evidence of reliability and validity, are more common within the RTI framework. These are typically referred to as standardized measures. So these tests have been tried on other students and there are statistics to support the conclusion that when a student is responding or performing well on the assessment, that they are not at risk, and that a student who is performing below a particular cut score or point on the assessment or who's not making progress is at risk. So these data are often mathematically computed and summarized. Scores such as percentiles, stanines, or other standard scores are commonly received as part of this type of assessment. Some examples of more formative assessments are things such as curriculum-based measures, curriculum-based assessments, pre- or post-tests, and benchmark assessments. Some less formal types may be teacher-made assessments such as classroom quizzes or exit forms that teachers may require of students as they complete a lesson at the end of each day. Formative assessments allow teachers to diagnose skill, ability, and knowledge gaps and measure progress and evaluate instruction. There are a variety of educational decisions that can be made from the use of formative assessments, including the identification of individual students who are non-responsive to instruction or interventions. They can also be used to drive curriculum and instructional decisions. They can be used to evaluate whether a particular instructional program is working, and they can be used to compare the quality of different instructional or intervention programs. They may also be used to help drive decisions about resource allocation. Formative assessments are not necessarily used for grading purposes. However, they are, again, intended to help teachers determine whether or not instruction is effective and if changes are needed. There are two types of formative assessments that are typically used. One is a mastery measure that is used to index a student's mastery of a hierarchy of objectives or skills, and these tend to be curriculum dependent, so they are reliant on the order in which skills have been taught within a particular curriculum. General outcome measures, on the other hand, reflect the overall competence of a student in the annual curriculum, and it also can help reflect the growth in students' competence or mastery of skills within the annual curriculum. Examples of general outcome measures include Ames-Webb's Reading CBM, Early Literacy and Numeracy, the Dynamic Indicators of Basic Early Literacy Skills, Retelling or Oral Reading Fluency Assessments, or ICEEP's Oral Reading Fluency Assessment, among others. The following quote is often helpful for individuals thinking about the differences between summative and formative assessment. When the cook tastes the soup, that's formative, but when the guests taste the soup, that's summative. At this time, we're going to complete the types of assessment handout. For each of the first 4 questions, there are 3 possible answers: summative, formative, or diagnostic. take a moment and pause the webinar to match the type of assessment with the description that's listed. Once you've completed the handout, press play to resume the webinar. So the correct answers to this handout are as follows. For the first question, the description is, measures a student's current knowledge and skills for the purpose of identifying a suitable program of learning. The answer is that is a diagnostic assessment. The second item says, tells us what students learned over a period of time in the past. It may tell us what to teach, but not how to teach. That is a summative assessment. The third item says, tells us how well students are responding to instruction. That would be a formative assessment. The next set of questions is asking when different assessments should be administered. Assessments administered during instruction are formative assessments. Assessments administered before instruction are diagnostic assessments. And assessments administered after instruction are summative assessments. The next question asks, who are the assessments typically administered to? For assessments administered to all students during universal or benchmark screening times and for some students as part of progress monitoring, those would be considered formative assessments. Assessments administered to all students are summative assessments. Assessments that are administered to some students are diagnostic assessments. For the purposes of driving educational decisions, assessments that are used for accountability for meeting standards or desired outcomes, for assessing skill mastery by students, and for future allocation of resources based on outcomes, we would typically use a summative assessment. For identification of students who are non-responsive to instruction or interventions, determination of curriculum instructional decisions or program evaluation, determination of resource allocation, alignment to meet students' needs, or comparison of instruction and intervention efficacy, we may use formative assessments. For help identifying what to teach and how to select an intervention, we may use diagnostic assessments. Now we'll spend some time talking about the difference between norm-referenced and criterion-referenced assessments. Norm-referenced tests include tests like the ACT, SAT, and GRE. Student scores are compared with each other using percentile scores. For example, a student who scores in the 64th percentile scored better than 64 out of 100 students who took the test. He or she scored lower than approximately 36 out of 100 students who took the test. Criterion-referenced tests are often standards-based tests that compare a student's performance to a criterion for mastery of a skill or objective. The score indicates whether the student met the mastery criteria, and so it often looks like a pass-fail or a proficiency score. Assessments, including screening assessments, can be both norm-referenced and criterion-referenced, depending on what information you're trying to gather. If you're interested in knowing how a student compares to another student in the screening process, you would probably be most interested in a norm-referenced assessment. If you want to screen for students to determine who did or did not meet a set criteria, then you will likely be interested in a criterion-referenced assessment. This will be discussed in more detail later. We are now going to talk in more detail about two common formats for formative assessments. Each type of measure has value, although they are typically used for different reasons. Mastery measurement indexes a student's successive mastery of a hierarchy of objectives or skills, whereas general outcome measures typically reflect overall competence or skill within an annual curriculum. So first we'll talk a little more about mastery measurement. A mastery measure describes mastery of a series of short-term instructional objectives. To implement mastery measurement, a teacher will typically determine a sensible instructional sequence for the school year and design criterion-referenced testing procedures to match each step in that instructional sequence. Here is an example of a fourth grade math computation curriculum with 10 objectives the teacher plans to accomplish for the year. The first objective is multidigit addition with regrouping. While teaching multi-digit addition with regrouping, the teacher may give assessments that look something like this. There are 10 problems all dealing with multi-digit addition with regrouping. As the teacher gives this assessment, he or she could graph the student's results. In the first week of teaching the objective, the student did not get many answers correct, as you can see on this graph. But, as you can also see, that as the weeks go by, the student gets better until he or she has reached 3 consecutive weeks of achieving 80% or better accuracy on a set of problems. Once this happens, then the teacher is confident that he or she has mastered the skill and will move the student to the next objective. The next objective in this curriculum is multi-digit subtraction with regrouping. Again, the teacher is teaching this objective, and while doing so, he or she may give assessments that look like this. In this example, it's 10 problems that all deal with multi-digit subtraction with regrouping. Note there is no practice of multi-digit addition with regrouping, which was the previous skill that was taught. Again, the student's progress is charted. A problem with this chart is that you cannot tell if the student is learning the objective at a pace fast enough that will allow him or her to learn all of the objectives in the curriculum during the school year. However, there are some important advantages to mastery measures as well. By focusing on a single skill, teachers can assess whether a student has learned certain target skills in isolation. They can also use the information from the ongoing data to make decisions about how to change instruction against that target skill. Until recently, the psychometric properties of most mastery measures were not established, and many were not valid or reliable. However, if you spend some time looking at the Mastery Measures section of the National RTI Center's Progress Monitoring Tools chart, there is increasing research demonstrating the validity and reliability of some of these tools. Mastery measures are typically not valid as screening measures. However, they are often used to monitor progress of students identified through screening as being potentially at risk. At the same time, there are some challenges associated with mastery measurement. First, the hierarchy of skills taught is often logical and not empirical. This means that while it may seem logical to teach addition before subtraction, there's no evidence-based research that says you have to do it this way. Second, the assessment does not necessarily reflect maintenance or generalization of skills. So after teaching subtraction with regrouping, you don't know if the student remembers how to do the addition with regrouping that you had taught previously. The number of objectives mastered does not necessarily relate well to performance on criterion measures. This means that how a student does on these isolated skill assessments does not necessarily indicate how well he or she will do on an end-of-year standardized assessment in math. Measurement methods are often designed by teachers, and therefore they have unknown reliability and validity. So again, if a teacher develops their own assessment, we don't know how well that assessment would compare to the similar kind of mastery measure that another teacher may develop, and we don't know if it's a reliable or consistent measure of student skills. Finally, it's difficult to compare the scores longitudinally. You will not be able to compare a student's score on a mastery measure in September with their score on that measure in May, because the different skills are being assessed, so the scores do not mean the same thing. General outcome measures, on the other hand, address many of the problems often associated with mastery measurement. First, it is program independent, which means that it reflects overall competence or growing skill in the year-long curriculum as opposed to being dependent on a particular program. It also describes an individual child's growth and development over time. Third, it also provides a decision-making model for designing and evaluating instructional interventions. And finally, it can be used for individual children or for groups of children. So for that reason, general outcome measures can be used for both screening and progress monitoring assessment. Some common characteristics of general outcome measures are that they are simple and efficient, which means that they are brief assessments that typically take no more than 1 to 10 minutes to administer, and they provide you with enough information to be able to make quick decisions. Classification accuracy can be established, That means that the classification accuracy tells you the extent to which the tool is able to accurately classify whether students are at risk or not at risk. They are sensitive to improvement, which means that they are able to measure the extent to which improvement on this assessment actually indicates that a student is making progress toward the outcome of interest. And if their student is not making progress, that is suggestive of them being at risk for a problem in that academic content area. They also provide performance data to guide and inform a variety of educational decisions. And importantly, the norms that are used, either at the national or local level, can be used for cross-comparisons of data over time. Advantages of GOMs include that they focus on repeated measures of performance. So there are no assumptions about the instructional hierarchy for determining measurement. In other words, they can be used with any instructional approach. Also, general outcome measures incorporate automatic tests of retention and generalization because they assess students on skills that have already been taught and may require a student to recall what they've learned, and they also will present students with skills that they have not yet been taught. And so if they have the ability to generalize or extrapolate what they have learned to the next step of the instructional sequence, this assessment would allow you to detect that as well. This allows the teacher to constantly assess whether the student is retaining what is taught earlier in the year and whether the student is able to think about what steps may come next. The point here is not to say that practitioners should always use a general outcome measure or a mastery measure, but it is important to think about how these measures differ and how they may be better for different objectives. For screening purposes, general outcome measures should always be used because GOMs work better to fulfill the objectives of a screening instrument. For an example of a general outcome measure, we should think about a curriculum-based measure. CBM is a general outcome measure of a student's performance in either basic academic skills or content knowledge. CBM was initially developed more than 30 years ago by Stan Dino and others at the University of Minnesota's Institute for Research on Learning Disabilities, and is a reliable and valid measurement system for evaluating growth in basic skills. Research began in the area of reading and has expanded to additional tools in the areas of literacy, mathematics, and writing, as well as tools in Spanish. So one example of a common curriculum-based measure is an oral reading fluency assessment. Students would be asked to read this passage aloud while being timed for 1 minute. The score would be based on the number of words read correctly per minute. In summary, both types of formative assessment provide useful but different information. Mastery measurement data indicate progress toward mastery of a specific set of subskills. For example, decoding short vowel sounds or calculating math facts, which is indicated by the graph on the left of this slide. On the other hand, general outcome measures indicate progress toward a broader outcome. So that approach involves the application of all subskills learned over time. That is demonstrated by the graph on the right side of the slide, which shows a student's progress over time compared to an instructional goal that has been set for him or her. One key difference between mastery measures and general outcome measures is the comparability of the data over time. With GOM, which is represented by the graph on the right, you can compare the score a student received in May to his or her score in September. This cannot be done with mastery measures because the skills assessed on the mastery measures differ over time, whereas the skills on the general outcome measure remain consistent over time. Thank you for taking the time to listen to Understanding Types of Assessment within an RTI Framework. To find more resources on this topic or to view other webinars in the Implementer series, visit www.rti4success.org. You can also view additional information from the RTI Action Network and the IDEA Partnership. Thank you.